Yeah.
This is Orson, the old guy from www.oldguytalks.com, here with Dr. Jill Zdan from Innova Medical Spa in Phoenix, Arizona, which I am a habitual patient there many a time. I've got my own place in the office here. I have my own room in the office, and I go in there quite a bit. And so today we're going to be talking about something that old guys like me and other old guys need to know about that does not involve men's health. It involves women's health. But before I do that, I'm going to talk a little bit about Dr. Zdan, Jill, about her basically her credentials. I think that's the word, the credentials. Yes, she's a graduate of the Southwest College of Naturopathic Medicine, and she's graduated magna cum laude. For those of you that know habla Latin, that means she's a very smart woman. So that's the translation of magna cum laude. How many people are there magna cum laude? Is that like what?
You mean in my class? How many people?
Yeah. How many people graduate magna cum laude?
There were 7 of us.
Oh, okay. So it's a very select group, magna cum laude. Very smart woman is what that means. Dr. Zdan administers all sorts of stuff. Some too many to mention all of them, but I'm going to mention a few here. Platelet-rich plasma, stem cells, ozone therapies, bioidentical hormones, shockwave treatment, O-Shots, Prp Shots, and a whole bunch of other stuff, including growing hair back. So today we're just going to be talking about the O-Shot. But before I do that, I need to keep Sue, the IP lawyer babe, happy by reading my medical disclaimer. And this goes this. This is information only. Consult with a proper professional before starting any program. Don't be stupid. You are responsible for your own shit. The old guy is a capitalist and not a socialist weasel. He will be promoting stuff here and may be compensated. The old guy only promotes stuff he uses. You will have different results, without a doubt, because we're all different and we all respond differently to things like that. So you may not know, I'm going to talk a little bit about myself because I love talking about myself sometimes. My kids tell me. You may not know, but in my previous life, when I was a periodontist, I don't know if you knew I was a periodontist by training. Okay. I was probably the first person to use PRP in the Valley. And I used PRP in dental surgeries in 2000.
Nice.
And
old hat for you.
Yeah, I know. Well, that's also old hat. Actually, it was so old that we did not have any centrifuges. We actually had to do it with an old hospital perfusion machine.
Huh.
Yeah.
I would like to see that.
Yeah, no, you wouldn't have. They're about as big as a washing machine.
Oh my goodness!
And they're really and every time we did it, the assistant had to take a Valium because there were so many wires and tubes going all over the place that she just wanted to make sure she got it all right. But no, it was a mess. And I've been through many centrifuges since then and things like that. So since I gave that little bit, let's talk. Tell everyone, what is platelet-rich plasma?
Okay. So platelet-rich plasma, and I'll start kind of just by describing how we get it. So first it starts all with a blood draw, right? We got to take a sample of the patient's blood. As you mentioned, you spin it down in a centrifuge, and what it does is it separates it into layers. So the red blood cells, because they're heavier, are going to go sink to the bottom, and within the middle, you get really the area that we want. It's called platelet-rich plasma, or the buffy coat, and it's full of at least 8 different growth factors, and that's really like what we call liquid gold. That's what you want to inject back into the patient. And these days, there are all sorts of kits, tons of different PRP kits where you don't have to do anything but spin it and it separates it out. That makes it easy. There's so many different ways to do it now. You even can make your own if you autoclave your Vacutainer tubes and then extract it out that way. So you get to be a little bit of a mad scientist if you want to, which is kind of fun. But yeah,
I don't know. I actually have a friend that I know does that. I think he is, and he injects himself too. I think he's insane.
A lot of people inject themselves.
He does that. And so typically, what's the concentration of the? Let's say you get 20 cc's of blood that you put in a centrifuge. How much of the platelet-rich plasma comes out?
All right, so 20 cc's, you would probably get out 20 cc's of blood, and you'd probably get about 3 cc's of platelet-rich plasma. Yeah.
Okay.
So and that's enough to do one joint. I mean, it's enough to do a lot of procedures. It just depends on what you need.
Sure. Yeah. Okay. So that's a pretty good yield on it. So it's a significant concentration of the growth factors that are in there. And you mentioned that there's 8 of them.
At least 8 that they know of. Yeah.
And so how the PRPs have actually been around a long time.
It has. I think since the 60s was the first time it was used, wasn't it? If I'm remembering correctly.
Yes, it was in the 60s, and then it was starting to use in Italy in the 70s in heart surgery, and then I got you. We're back. Little gap. There was a famous oral maxillofacial surgeon named Robert Marks, and in the 90s, and he was using it to reconstruct cancer patients. And he was able to achieve results with heart tissue bone growth that were not possible. They just were not possible with conventional techniques at that time. And some of the cases were just spectacular and life changing. So, what are the benefits of PRP?
Okay, the benefits of PRP is that it's a regenerative therapy. So once you inject it into whichever part of the body you need to, it's going to draw on your immune system. Your immune system is what's going to repair and regenerate an area. It's almost like tricking your body, because we're extracting and then concentrating those growth factors and then injecting them wherever they need to go to call in your immune system. You know, especially if it's a problem that's been going on for a long time, your body kind of forgets about it, right? You know, after you've had something for 3 months or tissue starts to deteriorate, maybe it didn't heal so well, you were sick, something like that. Your body's kind of like, oh, all right, we did the best we could with that. You know, it's been 3 months or so, and they move on. It's calling all those cytokines, the growth factors. It actually even stimulates your own stem cells to proliferate and then differentiate into the cells that you need to repair that area. So it's a really powerful therapy.
Okay. And when it does it, you mentioned that when you put it in, how long before you see the actual full effect of the PRP? Because it sounds like there's a lot of stuff going on that may take weeks or months. How long is it before you actually see, after you do the injection, you see the full effect?
Completely varies from person to person. That's the interesting part. So let's say even something like with the O-Shot, PRP for feminine rejuvenation, there are going to be people who the next day, they're going to feel much easier arousal, more frequent orgasms, things like that. But then there are other people where honestly, it can take a month before they really start to notice things. It depends how good your body is at regenerating. And that goes back to lifestyle. It goes back to how well you take care of yourself, your genetic predispositions, things like that. Epigenetics even.
Okay. So let's talk about the O-Shot in particular. And what's it used for, and what does it do for women?
Okay, so it's used for several things. I should just preface it by saying that the term O-Shot was designed and copyrighted by Dr. Charles Reynolds. So that's really his term. So you might see it online as well as PRP for feminine rejuvenation is a really another common term. Just so you know that they're very basically the same procedure, in my opinion.
Sure.
What we have patients come in for the most part is either low libido, they just have no sexual desire, their husband wants to, or their partner wants to have sexual affairs, and they just like, oh, I really don't even want to do it. It doesn't even enter their mind. That's one reason. Women who can get aroused, but then it takes so long to achieve an orgasm, or they just aren't able to achieve an orgasm. Then there are women who have pain during sex. They want to enjoy it, they want to do it, but it actually causes them pain during intercourse. As women get older, as estrogen levels decline, that vaginal tissue thins, it becomes dry, it can even become so delicate that women will bleed during sex. That's another thing it can really help with. Another side benefit, or even a major benefit, is helps really with urinary incontinence. It's another big problem for women, even just over 40. More than stress incontinence, I've had so many patients who they can't jog, they can't play golf without having to wear a pad to catch that urine leakage.
Sure.
It really has excellent results for that. And another thing, it really something called lichen sclerosus, which is an autoimmune condition where that genital tissue becomes either really hard or almost ulcerated, red, it can bleed, and extremely sensitive to touch. So even touching someone with acute itch can cause them pain.
I mean, that sounds very, very painful. That'd be a horrible thing to have.
Really a horrible condition. And then I'd say lastly, you have your women who really don't have a problem, what they say, with their sexual desire, but they want to say how good it can get. So we have a lot of women there too who are like, hey, let's just see how far we can take this. And just to increase their sexual health even more. And as preventive medicine, prevent the urinary incontinence, prevent the vaginal atrophy. So it just depends, on where the person's at, what they need.
Sure. So, and the range of benefits, what can someone expect? Let's say that they're somebody who's maybe postmenopausal. What can they expect from an O-Shot?
I would say more frequent and intense orgasms, easier sexual arousal. It even manages to increase their desire to have sex. It's not just, it actually pops in their mind, right? As opposed to having their partner be like, hey, try to talk them into it. I mean, honestly, let's be honest. Sometimes that happens in relationships, right? We hear it. Another complaint that we have from women is they're able to have an orgasm through stimulation of the clitoris, but they can't have an orgasm through stimulation of penetration through the vagina, the G-spot. So that is another area that we inject directly, that anterior vaginal wall, and that really helps to rejuvenate that tissue for them.
Okay.
Again, reduces that urinary incontinence, stimulates healthy collagen in that whole area. That's another benefit of PRP anywhere in the body. So you're going to tone that vaginal wall, and it also helps to create new blood vessel growth. So anytime you have new capillary growth go into an area, right, you're getting nutrition there, it's able to feed the cells better, everything is healthier.
Okay. All right. And what has been your experience, whether people needing one versus multiple shots, and what would be if they need multiple shots, how far apart do you spread them to get the best result?
Good question. Usually, I'd say the majority of people honestly only need one per year. Now, if it's a lichen sclerosis patient or someone who had really atrophied tissue or really bad urinary incontinence, they can have another one in 2 months. And then most people choose to just have 1 or 2 per year thereafter. But then there are some women who, we've heard that it's been 3 years since they had one. And now that they were able to wait that long before they noticed any diminution of the results. So it's really, I think it's impressive, something to last that long.
Okay. And you kind of touched upon it, but basically you're saying that a lot of times it's a once-a-year procedure as a general rule, but maybe more frequent or less frequent depending on where you're at in that regard.
Yeah. Yep.
Now, let's say you got to a certain level of responsiveness, and we'll just talk about sexual responsiveness.
Sure.
But it's not quite really there where you want. Is that where you start thinking about doing a second injection within a shorter time frame period?
Yes. Yep. Exactly.
Okay.
Yeah.
All right. And let's talk about what are the risks? What are risks and complications that can occur with PRP shot?
They're fortunately, very, very few. I mean, I guess potentially, I've never seen it happen, and all the doctors that I've spoken to have never seen it happen. I guess you could, if you went in just right, you could nick a little bit of a nerve, but it might lose just a little bit of sensation, but that will come back. Fortunately, we know now that nerves can regenerate and heal themselves. But I would say that's probably, honestly, the only other complication. One, perhaps, let's say someone had a really full bladder. Like they just drank a gallon and they're nervous about this procedure and they don't want to go to the bathroom and they're just holding it. And let's just say they move during the procedure. I mean, very unlikely, but the needle could go up towards the urethra or the bladder, but it's so. I've never heard of it happening. These are all like hypothetical.
Sure.
So always advise, have the patient empty their bladder before the treatment. Just take all the necessary precautions to make sure the patient is safe.
Okay. And any contraindications to the procedure?
I mean, the only thing I would think of is I would have the discussion on sexual abuse, just to make sure that there wasn't a history of that, because this could be potentially traumatic to the patient, even though it has a therapeutic benefit. It could just trigger some memories. That's always a good idea. But unless they have a bleeding disorder, something along those lines, there are no major contraindications. If they're on anticoagulants, say they're, on Eliquis or heparin, something like that. But there aren't that many contraindications, which is great.
Oh, wonderful, wonderful. And when you consult with a patient, is there anything that you say that we really haven't talked about regarding this at this point?
Yeah, I mean, we ideally like to get a good medical history, right? We want to know, let's find out what are the cause of your symptoms. Ideally, we would like to run hormone levels, thyroid levels, red blood cells, white blood cells, liver, kidney function as basic labs, get their medical history to really see what's going on. There even have been women, we want to find out, have there ever been a trauma to the area? Did you have an accident on a bicycle? Something like that. You really want to just make sure you're not overlooking something that could be contributing to their symptoms. Is really what I would say.
All right. And do you ever use anything in conjunction as with the PRP to increase the results or maximize the benefits there?
You can also inject ozone. So I know you're familiar with ozone. The 3 molecules of oxygen in gas form really also helps to stimulate new blood vessel growth to the area, also helps to break up any scar tissue. Another reason I think I forgot to mention that women do have this procedure is that they have scar tissue actually after childbirth. So injecting using that as a conjunctive treatment can really help to resolve that as well. There's also the pulse wave machine. So the pulse wave is acoustic sound waves, which really, that device originally started off for kidney stones, and they toned it down to a reasonable level where it could be used for many other things. And those sound waves traveling through the tissue is excellent for helping urinary incontinence, excellent for helping to strengthen the vaginal wall. That's another treatment we use in conjunction with the PRP a lot as well.
And typically on the sonic wave treatment, how many sessions is that?
So what we like to do is really 10 treatments is really what we like to do, 1 per week for 10 weeks.
Okay. Yep. All right. Okay. So that's a lot of interesting stuff. So everybody's going to ask, okay, an injection into the vagina, pain level.
The most I've heard is 3 out of 10, 10 being worst. So just to give it like a brief description of the procedure, essentially you apply numbing cream to the whole area that's going to be injected. So that includes the clitoris, around the urethra, the anterior vaginal wall. Then they go have their blood draws, the numbing cream kicks in. You get your platelets, your platelet-rich plasma. You can inject about 0.35 of a cc of lidocaine right into the clitoris. Some women decline having this only because they're going to get stuck with the needle either way, right? So you're either going to stick them with the needle for the lidocaine and then stick them with the needle for the PRP, or you can just do the 1 needle stick with the PRP. So it's, either way with that one. And then if urinary incontinence is a big issue and you're just going to inject 1 cc, which is a really small amount, of the PRP into the clitoris, and you can inject 1 cc on either side of the urethra, which really helps with the urinary incontinence. And then you go just into the anterior or the front vaginal wall, and that's 5 cc's of PRP that you inject there. And really, women are tough in general. They don't usually, they're always surprised at how little it hurts, is what we find.
Sure. I think, sometimes it's just the idea of it, of getting it done. Okay. Yeah. All right. So, Joe, if somebody wants to see you, where do they find you?
Yeah, I practice at Innova Medical and Spa. We're at 1530 West Glendale Avenue, Suite 106 in Phoenix. Our number's 602-973-1774. And yeah, feel free. We also do free 15-minute consults in case someone wants to just discuss whether a procedure is right for them or not as well, which is helpful for the patient.
Well, that's really nice of you guys to do that. Yeah. So let me just put that phone number into the notes here, so when somebody sees it, it is 602.
Yep. 973. 1774.
1774. All right. And we'll do that. And so, so that's a number and where they can find you and locate you and make an appointment to see you to get this life-changing experience. So tell me a little bit about what are the things that you've heard from your patients in terms of what has it done to improve the quality of their life?
Yeah, absolutely. So the biggest one you hear things like "you saved my marriage," because that sexual intimacy really does tend to bring a couple closer. So that's really the most common one we hear. And the second one is helpful with urinary incontinence. When you have a woman who has to wear a pad every time she leaves the house, she plans her day by bathroom stops along where she's going that day. She has to know where she can hit a bathroom if she needs one.
Sure.
That really changes their life as well. And then we also have the people who are just so appreciative at how much their sex life or their ability to have an orgasm, the sensitivity during the orgasm has improved. And women being able to have multiple orgasms, that's another thing too, increasing the frequency.
Mm-hmm. Okay. Yep. All right. Well, that's really what it's all about, is improving the quality of someone's life. Absolutely. And helping them do that. And that's certainly a big factor here in your therapy and what you do there also. So tell us a little bit about some of the other uses of PRP outside of the O-Shot that you do in the office there.
Sure. So there are aesthetic practices you can do. One would be microneedling. So microneedling pen has just tiny, multiple really fine needles that just goes up and down in the pen. So you create these tiny little holes all over the face, and then you massage the PRP into those holes. So it's really called
I believe that you're using the technical name. I believe they call that the Vampire Facelift.
Oh, see, that's actually a different one.
Oh, is it? So, okay. So what is that?
Yep. So the facelift is when you take PRP and you use some of the regular PRP, and then you can ozonate some of the PRP, warm it gently so it almost forms like a natural gel or filler. And then you can inject it here to get, improve the cheekbone height and improve this through here, all these little wrinkles. And it just really overall improves the vitality and health of the skin and gives that plumped up effect as if you were doing a facelift, but it's natural. So you're not putting in real synthetic fillers.
Okay.
Yep.
All right. And there again, that one also, it's one of those that actually over time it actually improves as the PRP draws in blood vessels.
Exactly. And it's really for women who don't want anything synthetic in their face. You obviously can do Botox and you can do regular hyaluronic acid fillers and get those really fast results. But for women who like to do things naturally, even if it takes a little more time to build up the results, build up the collagen, it's a great procedure. It gets you that glow too. The skin just looks radiant. Yeah. Then there's always joint pain. We do tons of PRP for joint pain. I mean, knees, shoulders, so common. Get excellent results with that.
Yeah, we have a friend who's actually one of your patients, and he really regretted that he got the surgery on his one knee.
Oh, because the other one turned out so well.
Yeah, it didn't turn out so well, and then I turned him on to you guys, and he was very happy, but he's still dealing with the other knee. So he's still got some residual issues with the one that had surgery on it. So yeah. So Jill, we're kind of coming up here on the end of our interview, but I don't know if you were aware, but the old guy is about vices and virtues, and we've been talking about the virtues, but we always like to find out a little bit about the vices of our guests on this program. Sure. So I got a couple of questions here for you. First of all, I'll start off with the easy ones and we'll work our way on. What kind of music do you like to listen to?
Oh man, I'm really eclectic with that. I love everything from classical music to Motown, classic rock. I don't like today's music, I have to say. Like, I don't know if I was born in the wrong decade, but anything past the 80s, I just am not a huge fan of usually, except for maybe some dance music. But yeah, I really love the classics, like classic rock, classical music. Sometimes there are some good songs that are modern, but I don't know. I'm not a huge fan of today's music, I hate to say, but that's me.
All right. And so do you drink alcohol?
You know what? I've never liked it, to be very honest. Yeah, I've tried it and it just makes me feel bad. Like,
okay. Well,
I'm one of those weird. Yeah, I'm one of those weird people. Like, if I had a vice, honestly, sugar and carbohydrates are my vice. Like, that's something where if someone told me, you will never in your life, even at a holiday dinner, be able to have, something sweet, I'd be really sad. Okay. That's really my vice. But yeah, alcohol, I don't know why. It just doesn't, my neurotransmitters must be different. It just doesn't work with me the way it does in regular people.
And do you smoke cigars?
I don't. No. Very boring. I'm sorry.
And then, and then, if you were hiding and doing something in the closet, what would that be?
Interesting. I don't know if I've ever hidden in the closet to. That's a.
Or you had to close the door to do something. What would it be?
I'd probably be eating more cake than I should be. Something like that. That would be what I'd be hiding. Yeah, right, it's tough because as a naturopathic physician, we know that sugar is not good for you. You know, refined carbohydrates are not good for anybody, right? But I do really enjoy them. I've got to say, love chocolate, all that.
Yeah. Well, I'll tell you, I need to share with you and the people on this interview that the most interesting answer I had to that was with a woman who's a sex therapist. And she's actually a very famous sex therapist. She did a TED Talk with over 15 million views of her TED Talk. But we had a fun time. But that was interesting.
Sure.
That was an interesting answer on that. So, well, that's all I got. Unless you think we got anything else that we need to cover here.
No, I think you asked all the right questions there. Yep, I think we got all the information. Yeah.
Okay. Well, thank you. And if you guys, this is information you need to know and share with that special one in your life. And this is it's about improving the quality of life. And as the old guy says before he signs off, Old Guy Talks is all about creating a kick-ass life for yourself and those that you love. And the O-Shot is a big part of it. Take care, and we will see you later. Okay.